Welcome to the Author Corner, our chance to meet the authors you'll want to read. I'm Stephanie, and I'm so excited today to be joined by author Nicole Christensen. She's the author of From Crisis to Calm, a patient advocate's take on the healthcare. So thanks for joining me.
Thank you for inviting me.
I'm so thrilled to have you, and I have so many questions because I'm not even sure really what a patient advocate does. So you really have to tell. I've heard the term a million times. I'm sure you're the person I'm supposed to be calling. So we're going to get to that and the book, but I'm thrilled that you're here. So first off, how long have you been doing what you do?
So I started Care Answered 9 years ago. And I've been an advocate for about 25 years. I actually started in DC as an advocate for senior citizens. And then from there changed my entire trajectory and brought me to where I am now.
Okay, so you were an advocate in DC before you formed an advocacy company.
Correct.
Now, what does it mean to be an advocate?
It's a good question. I'm sure everybody asks it.
It sounds like something important, like I need her, but I'm not really sure why.
I like to think so, that all patients need an advocate. So I'm a board certified patient advocate. And what that means is I advocate so that people can access their best care. It's very siloed and it's really broken in the United States. And it can be very overwhelming for caregivers and patients alike to navigate themselves through the system. So this term patient advocacy grew up with my organization.
Oh, okay.
I'm kind of older in the business, older in the field, I should say. And it has grown substantially because the need is so great.
Well, it's so complicated. You know, we have to kind of manage, I guess, even if someone just ends up with an operation and opinions and second opinions and aftercare and rehab and all those things. But I can't even imagine once somebody is older or with a chronic condition.
Yeah, it's for any of us, right? Anybody that's a patient, which is everybody. Anytime you even go into a doctor's office, you have a few minutes, if you're lucky.
If you're lucky, right.
To ask all your questions and to get all your answers. And then you're rushed out the door. And then oftentimes you come home to a loved one or somebody that cares about you that knew you had a doctor's appointment. And they say, how'd it go? And you're like, I don't know. I think I have a test I have to take next week. I have to not eat that day. You know, and that's all they know because we're so in a rush to get out of it. We don't want to hear any bad news. And they have very little time to spend with us because that's just how our health care system works in the United States. And if you're an older adult, there's something called healthcare literacy. When people hear literacy or illiteracy, they think, well, I'm smart. It has nothing to do with how educated or how smart you are. But our healthcare literacy is very low in the United States. And it's especially low for those who are 65 and over. And why that is, there's probably a myriad of reasons, right? But one of the things I think contributes to it is we think of doctors as the all-knowing. They're very smart. They've gone to school for a very long time. They have their expertise. This is absolutely true. But what I tell all people, all patients, is you are the expert in yourself, in your body and how you're feeling and what you want to articulate. So we have to be able to articulate ourselves in a doctor's appointment to say what's wrong, what we're concerned about, and then get those answers of what could it be or what do I need to do next. And older adults have a hard time following through even with those recommendations they hear. Whether it comes down to prescriptions or what they're supposed to take or the test they're supposed to take or when they're even supposed to follow up with their next appointment or if they have a follow-up with a different kind of doctor. Because the truth is we need a doctor for every part of our body, it seems like.
True.
So.
And it seems the healthcare system, besides the doctors and people, is increasingly technological.
Yes.
Like everything is a portal. Like
Yes.
you can't even get someone on the phone. You're supposed to go to the portal.
Exactly.
And get your test results there and make your appointments there. So like you said, for older adults, navigating all of this technology.
Yeah, it's really very tricky. And we had a pandemic, right? So it was very, very difficult in that time for anybody. The upside could be thought of oh, we had this technology, so we could see our clinicians virtually. But I had clients in that time that they couldn't access the information. They had the smartphone.
Right.
They may have gotten it from their grandchild, but they didn't get the time to understand how to use the portal within it. So that was very, very difficult for people. And it continues to be difficult. And I don't have numbers on it, but from my experience, people using the portal in general, and I mean people 35 to 105, they don't use it that often, which is really unfortunate. Sometimes it's technology, and sometimes it's just a pain in the butt.
Right.
Right?
I don't remember the password.
Exactly. Exactly. And if you have a clinician, like we were just talking about, you have a doctor for each part of your body.
It's a lot of passwords.
So there's a lot of passwords and a lot of portals. Right. And some of them are better than others, to be perfectly honest.
Right.
And so people are like, oh, forget it.
Yeah.
But they can really help people access it. So if you have the technology, I always advise everybody to use that portal, because that can give you access to your clinician much easier. Because it used to be, you went to the doctor, if you had an appointment 3 months later and you came up with a question afterwards and you didn't have a patient advocate like me, good luck trying to get in touch with that clinician, like you were saying, making a phone call, even when that was the thing. It was very hard to get in touch with your clinician. Now, with many of the portals, you can ask a question via a text or email through the portal, and you'll get a response the next day. I've had clinicians call my clients, as well as myself personally, at like 8 o'clock at night, and I'm like, oh gosh, that must mean bad news. But it wasn't. It was just to reassure me. So I appreciate that, and people should access it. The other thing that I really want to emphasize for all patients is that starting 2 years ago, the doctor's notes are accessible on portals as well. Yeah, that was not the case. So you would see, even if you ask for your medical records, right, which you always have the right to, you can get them paper, and I suggest people get that if they're not comfortable with a portal. And they will have all of your notes and your medications and that kind of thing. But this now has the doctor's notes. So that could be what the clinician and the patient discussed and what the next steps are. When I was talking about healthcare literacy, those follow-up steps can be right there so you can read them. And mistakes happen a lot of times because we're all human. We're all human. We make mistakes. Doctors are human as well.
Well, they also have like hundreds of patients.
Hundreds of patients and very little time, right? So we all have to be prepared to be our own advocate as a patient, because we want to make sure that who they're talking about is who we are, right? That wasn't the other Nicole Christensen that was supposed to come in last week. You want to make sure.
That could happen.
Absolutely. It happens all the time. Medical error is very, very common, and it's deadly. So.
Yeah, I mean, you think about people who are going in and they have to write on which leg are you having this surgery on or something.
Yes.
So if they have to do that and something as obvious as left or right, one would think, then anything can fall through the cracks.
Absolutely. Again, we're all human, and we tout AI, which is fabulous, but it is also programmed originally by humans. So we do have to make sure that they're talking to us and that our concerns are being addressed. I had a client one time that was in the hospital, and I was checking in on them, and it was via the phone, and they said, oh, you know, we're teaching him and we're giving him his insulin now and making sure he knows how to use it. This person had no cognition, unfortunately, and could not speak and did not have diabetes. So it was fortunate that at that time I called, I said, you have the wrong patient. That is the wrong patient. And we went through it and they said, oh, I'm so sorry. Fortunately, they didn't give the insulin to that patient, but these are kinds of things that happen all the time. So we have to be our best advocate and or hire an advocate for ourselves.
That is terrifying.
It is.
Now, I took a glance through, and some of the things that are here, and you're saying be your own best advocate, like places to list all that the doctor says, or all of your medications, or all of this paperwork that we forget about.
Yep.
And making decisions about things, especially with older adults.
Correct.
Is that primarily the, I'll say, audience that you deal with, or older adults?
Yes, I specialize and I love working with older adults and their families and their caregivers. But we work at Care Answered with adults in general. And the book, From Crisis to Calm, we're all aging. If we're not, the
You
other.
have to say that out loud.
We all have to get older. That's a part of life. And so it doesn't matter your age. All of this information can be very helpful because, as I said, we're all patients. Right. So whatever questions we might have for our clinician that we think we're going to remember, even though our appointment's in 2 months, we're not going to remember it.
Oh, you're right.
It's just not going to happen.
And like you said, they come in like a whirlwind. They're in, they touch you 3 times, and then they're out. And you're like, I forgot to ask all these questions.
Exactly. It's overwhelming. And then, so if you write down your concerns when they happen, and you ask those questions and write down the answers you were given,
right.
That's going to make you a better advocate for yourself. And so within the book, it actually has, it's partially a health notebook.
Yes.
So you can write down
so
those things.
It gives you a place to put all that stuff.
Yes.
You've got medication charts and things, because I know I have no idea. I'm sure you're a much better mother than I am. You know what every kid has ever had, this and that.
No, I would not say I am a better mother than you are.
But I'm sure you know the answers to all of these questions.
I do, but then I forgot how to spell them, right? But the thing is, for older adults, generally speaking, they have a lot of medications. And when a medication list that I'm talking about includes your over-the-counter medications. That's what people often forget, or supplements.
Yeah, because they're going to have...
Yep, they could have interactions,
right.
Or they may not be appropriate to take at a certain time of day. So with that list of medications that's included in the book, and everybody should have, if you take any kind of medication, it should have the name of the medication, the dosage, who prescribed it, why you take the medication.
Wow.
Right? And hopefully what time of day you take the medication, because this is the reality. Hopefully we'll all live to a very ripe old age and die in our bed, right? But we can be...
Spoken from a patient advocate.
That's the dream, right? But if you could be 21 and get into a car accident.
Yeah.
And if you are on a medication because you have some sort of illness or what have you, and they don't know that you're on that medication,
that could be very problematic.
Yes, it can be very problematic because they're in triage, right? So you were in a car accident, so they're trying to fix everything. And you're on a medication that is counterindicated for what they're trying to triage, and they don't know it. So one of the big things for everybody 18 and over is to have a healthcare proxy.
Okay.
And that's really very important, and that's in the book as well. And what that is somebody to make your healthcare decisions if you are incapacitated. So if, God forbid, I fainted right now, I would be incapacitated, right?
I'd help you.
Thank you. I appreciate that.
I just want to tell you, I'd help you.
I appreciate that. But do you know my medication?
I have no idea, but I'm going to do my best.
But luckily, in my purse, I have an Honor My Decisions card that Care Answered does. So it's a QR scan. So if I had to be put into an emergency situation in a hospital, they could scan that, know who my healthcare proxy is, and I'd be taken care of.
I love that. And you said 18 and older. Yeah. So we're talking college kids.
Yes, very common. Unfortunately, many of us have heard the horror stories of, the family lives in New York. Their child gets into school in North Carolina, and they're off, and something happens. And the family is calling, they're calling the hospital, and they're saying, what's happening? This is what you need to do for my daughter or son.
Right.
And they say, we can't talk to you.
Ooh.
This person, in the eyes of who knows who, not their parents, is an adult,
Right.
right? At 18 or 19 years old.
Yeah.
And so you can either have a HIPAA release form, which is a form that each hospital has, which unfortunately each one has a different one.
Oh, it's not like a standardized thing?
No, it isn't. It should be. But sometimes I've had experiences in which other hospitals won't take it.
Oh.
So your best bet is to have your healthcare proxy. And
So
again,
that thing in your wallet.
yes, the thing that I have and that everybody should have. But the healthcare proxy is a form. It's not a hard form. Most important is the discussions behind the healthcare proxy. So just to be a healthcare proxy, okay. But if you're my healthcare proxy, then you have to know about me, right? I want you to know what decisions I would make. So you're not making decisions for me.
Right.
You're just carrying out my
Your
decisions.
wishes, right. And that's a whole lot of conversations.
Yes, that's a whole lot of conversations.
Most of us probably don't even know the answers to those questions in our own head, never mind whether or not that next person in line
right.
knows what the answers to.
Right. And the person that we pick for that may not be the person we love the most or is closest to us.
Ooh, yes, because they might not necessarily agree.
Exactly.
Ooh.
So you have to pick wisely, and you have to have that discussion so that people can feel honest and say, "That's what you want." I don't
Those
think
are
I'd be
kind
able
of
to do it.
heavy conversations to be having.
Yeah, and I say it lightly because I'm like, have it every day, because of the work that I do. But I know it's difficult
that's
for people.
a big conversation. So, Mom, at what point do you want me to pull the plug? I mean, that's what we're talking about here, right?
Well, that's what people think of. Pull the plug, don't pull the plug, right?
Okay, there's more than that.
But there's more than that.
Okay.
Like I just said, if I was unconscious,
Right.
I'm probably going to be okay.
I'd
right?
like to think you'd like me to wake you up. Do I have to check your QR code first?
No. Please try to
smack
wake
you?
me up. But
Pour some water on you?
You can smack me, put the water on me. Give it a whirl. But if I were unconscious and I stayed unconscious
Right.
for the ride to the hospital, I'll probably be fine.
Right.
God willing. But in that time, people need to know what I want done. Right? There are some people that have for religious reasons.
That's true.
They don't want certain things done.
Right. No blood transfusions.
Yeah, all sorts of different things that people, if it's not discussed, or if your healthcare proxy is not of your same faith tradition, so they don't know all of those things, that's a problem. So this is it doesn't have to be morbid. It really isn't. It's about, we call it care control partners. You're taking control of your care. So that everybody knows what you want so that they can follow through. There are other horror stories of people that have been healthcare proxies but didn't know what that person wanted. And so they live the rest of their lives, if they've passed away, not knowing if they did the right thing.
Right.
And nobody wants to leave anybody with that.
No, you want to know that you're doing right
What
by
they
this
wanted.
person.
Exactly.
But yeah, this is a lot of tough conversations. This is more than just what do you want for dinner.
No, yeah, it's a little bit more than that. But it's also about how you want to live your life. Right? It can be how you want to die, right? And that's part of life. But it's also how you want to live your life. When we think about that, we think about when people say pull the plug, like, do you want to have the capacity to eat? If that's the quality of life for you, you want to be able to eat. So therefore, if you need food to go into you without utensils, without your knowledge, that's not living to you. That healthcare proxy needs to know that.
Wow, that's pretty specific.
Yeah.
So dinner at your house is a lot of fun. Huh?
We don't talk about it every day, but it is just. I wish
Thanksgiving.
Yeah.
While we're all here.
That's true. That's what I say. People talk about it at Thanksgiving because that's when you see people. And if you make it just like, oh yeah, I still want, everything done. Because there's people that are like, freeze me, do whatever, And then there's people like, no, if I can't read a book, I don't want it.
Just
yeah, exactly. People have different thoughts, and it changes throughout time. So that conversation has to be ongoing.
Yeah.
So
because
something
what you
I would
think
say
at 20,
now.
Right.
If I'm fortunate enough to live to 85, I may not have the same opinion now. So it's an ongoing conversation.
So we have to have fun holidays for years to come.
Yeah, you make it a game. Let's see. Who wants what?
why don't we make the board game?
This is your life, or how do you want
There's got to be a
life?
way to make this kind of fun.
Yeah. There's always
like
a
I roll the dice and okay, so you got hit by a car and you can't eat. What do you want? And then by the end, everybody ends up with a checklist with all their things and a QR code.
Stephanie. You just nailed it.
Right?
Yeah.
Wouldn't that make it a little
Watch for the game From Crisis to Calm.
I think it could be great.
I think it could be. Isn't there that game like something
It's
humanity
like the game
or something?
Cards Against Humanity. Oh God!
It's a different version.
You're making yours like raunchy. Now we have to drink while we're drinking. I was thinking it was like the game of life. But at every stage, like bad things happen to you and you have to make decisions.
That's life, right? That life has wonderful joy.
But if it did start to like fill in a card for you so that by the end, everyone ends with a card and a QR code.
Absolutely. Well, that's what we do at Care Answered. We facilitate that conversation.
There
and
we
it is
go.
exactly. We ask the questions.
All that without dice.
And all that without dice. But I think dice probably makes it more fun.
I think so.
Yeah.
Or a glass of wine, depending on how that conversation is going. But that's what you do. You end up sitting down with people and having this conversation.
Yes, I do that. And it's also all the advocacy. At Care Answered, we really look at the transitions of life. So when we're diagnosed with something catastrophic or chronic, or we're going in or out of a hospital or healthcare institution, or our health has declined. You know, we had a diagnosis a long time ago, but our health has now declined. And what are the options? Our job at Care Answered is to access the best care for our clients and give peace of mind to their loved ones, as well as empower all patients. So Care Answered is that, and that is our goal and mission. And then From Crisis to Calm is just an enlargement of that. So we're not going to affect everybody in the whole world, and maybe but everybody in the whole world won't read From Crisis to Calm, but it hits more people so that they can better know.
It's a good starter and a great conversation starter.
Yeah.
I mean, it's a great workbook for you to keep like all of your medications and your answers to these questions and tips and questions to ask for when looking for a home health aide. That's a really good idea. But all those things that you never think of.
You don't think of it, and it's very overwhelming for caregivers, especially.
And everyone, I mean, statistically speaking, like 95% of the population at some point is going to be a caregiver or something like that.
Correct. A caregiver for an adult.
Right.
Correct. So there's a quote in the beginning of my book from Rosalind Carter and I'm going to paraphrase because I always get it wrong, but you're either going to be a caregiver, need a caregiver, or something else. The point is that
caregiver.
Exactly. We all end up
Yes.
being a caregiver of some kind.
Absolutely.
For the most part.
I mean, everybody, really.
Every single person.
I mean, unless you just live alone in the woods.
Yeah, I guess if you live off the grid, but somebody's got to be caring for you unless you're going to get eaten by bears or something.
Well, I mean, that's a way of just avoiding this whole conversation, isn't it? Just go straight for eaten by bears. You are just a barrel of laughs today.
I was thinking about my trip to Yellowstone, sorry. I was like, grizzly bears, they'll get you.
I was really hoping that that's not what happened when you were in Yellowstone.
No, that is not what happened. Clearly, I am here. But we saw grizzly bears. They mean business.
They absolutely mean business. So I hope when you saw them, you had that QR code.
I did. I had it all with me.
Okay.
But we were also smart enough to stay far away.
Well, there we go. And before you're going to do anything like skiing or,
Exactly. Or any of those
whitewater
things.
rafting, get that QR code going.
Make sure you have your healthcare proxy if you're 18 or up.
Yeah, no, that's a lot to think about. It really is.
It is. And it doesn't have to be so big. In our country, we make it almost stigmatized, and it doesn't need to be a conversation like that. It's just a part of life, and so we have these options.
Do you just go to people's families and introduce? Because how many people sit around saying, "I know I should bring this up, but I really don't know how to bring this up"? Like,
Well,
you could just be like the perpetual dinner guest. Now that we're all here.
I don't think I'd be invited over very often.
Well,
but
we only need once.
we only need you once. But yeah, I mean, I really tout it because even during the pandemic for Care Answered, we did a lot of pro bono work, and we got a lot of calls of people who weren't married, and they were in a
Ooh.
psychiatric institution, and they were like, how can you help me? And this is their loved one talking to me. And I don't have any power.
Right.
Because they didn't have a healthcare proxy.
Oh.
And when it's a psychiatric diagnosis, they really appropriately really guard one's privacy.
Right.
And you can't get anywhere without being a healthcare proxy. And we all know how mental illness is really taking hold of this
huge.
whole world, nevertheless this country. And so just with that in mind, and after the pandemic as well, and during the pandemic, it really hit us hard, or actually maybe made it more known.
Yeah.
And so when we think about those things, and if you're in a psychiatric institution, you do not have you don't have a capacity in their minds, and now you don't have a healthcare proxy, so you're alone. So
I mean, that alone is a reason to make sure you get these things taken care of, because, like you said, mental health issues are rampant, and none of us know what's tomorrow.
We don't know what tomorrow is, and so why not protect ourselves? And I have a patient advocate for myself if I'm in a hospital. Everybody needs one, because you're just out of sorts. Your loved ones also feel like they've been hit with a bomb.
Right.
So somebody there to just make sure you know the options and you're understanding everything so that you can access your best care.
You're right. I might think that I can talk to a doctor. How many times do you walk out of an office and say, I have no idea what they just said?
Exactly. Exactly. And one of the things I talk about in the book as well, and when I tell people when I'm speaking, I say, ask them to repeat it so that you can understand it, and repeat what they said in your own words.
Right.
Because that's a learning for you so that you know, and it's for the clinician as well, because they'll say, then no, that's not what that's not what I was saying.
And take notes.
Exactly.
And definitely take notes.
Take notes.
Well, you've been enlightening, but maybe not joyful. But
always joyful. Always joyful.
I think the board game is something we're definitely
we're going to
discuss.
pursue that.
But for all of us, go and have those difficult conversations. From crisis to calm, a patient advocate's take on healthcare coordination, a good place for you to start talking, thinking, and recording some of the important decisions in your life. Thanks for joining me.
Thank you.
We're just books up on a shelf. Try to understand this if you can.